everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be dealing with a hemolytic disorder, which is sickle cell anemia. Now, what basically happens in sickle cell anemia is that there would be abnormal hemoglobin on the RBC. Now, what we mean by abnormal hemoglobin, that we would learn in the later slides. So basically, this is a genetic disorder. That means it is inherited. And also, the RBCs here would be very weak. By weak, we mean to say that, the lifespan of RBCs would be only 20 days. So, whereas for normal RBCs, we know that the lifespan would be 120 days. But here, in sickle cell anemia, the RBCs would have a lifespan of only 20 days. Next, let us move on to the definition of sickle cell anemia. So, sickle cell anemia is an autosomal recessive disorder in which abnormal hemoglobin causes chronic hemolytic anemia. So, here in the first line, we can see that sickle cell anemia is an autosomal recessive disorder, right? So what we mean by autosomal recessive disorder? Now, autosomal means definitely it is not related to sex chromosomes, right? That means it's not related to the X chromosome or Y chromosome. So it doesn't matter if the, newborn baby is going to be a male baby or a female baby, right? So here the sex of the baby won't, matter. And recessive means that here, in order for the person to get affected with the disease, the gene has to be homozygous, right? So here, the child has to receive this mutated gene from both the parent to get affected because it is a recessive disorder. So if the child receives one mutated gene and the other healthy gene, then in that case, the child will be a carrier because here the gene is recessive. So it is not that powerful that it can overpower the healthy gene and cause the disease. So that's the reason here, it has to be homozygous in order to, affect the person. So sickle cell anemia is an autosomal recessive disorder in which abnormal hemoglobin causes hemolytic anemia. So in this disease, abnormal hemoglobin causes hemolytic anemia, right? Now, to understand what is abnormal hemoglobin or what kind of hemoglobin would be present in sickle cell anemia, let us, learn a bit about the structure of hemoglobin. So the first thing we know about hemoglobin is that it is, oxygen carrying pigment, right? It is an oxygen carrying pigment. So it is a protein which has the capacity to carry oxygen, and it is very important for the RBC. So basically, this hemoglobin is made up of 4 globin chains, and each of these globin chain would be bound to a heme group. So we have majorly 4 types of globin chains, that is alpha, beta, gamma and delta. And each of these globin chain would, bound to a heme group. So based on which globin chain would bind to which kind of heme group, there are different types of hemoglobin. So we have hemoglobin F, which is called as fetal hemoglobin. Then we have hemoglobin A, which is known as adult form of hemoglobin. And also we have hemoglobin A2, which is a small fraction of the adult form of hemoglobin. So all these types of hemoglobins are having different structures because they are having different globin chains, right? And they are bound to, each of these globin chains are bound to heme group. So as I told you that there is hemoglobin F, right, which is known as fetal hemoglobin. Now this would be present when the baby is in the uterus, right? So it is present in the fetus. So that is why it is called as fetal hemoglobin. Now once the baby is born, after that, there will be hemoglobin A because the body would start producing the adult form of hemoglobin, right? So this is the normal hemoglobin which should be there, that is hemoglobin A. But here, because of the mutation in the, in the gene, because of that, there will be hemoglobin S instead of hemoglobin A. So we know that hemoglobin carries oxygen, right? And it is very important for the RBCs to have the hemoglobin because it carries oxygen to the tissues and to the organs, and for the organs to work properly, it is oxygen is needed, right? So hemoglobin A is the normal hemoglobin which carries oxygen. But here we have hemoglobin S, which is the abnormal hemoglobin, and it does not carry oxygen. So this is what we are referring to as abnormal hemoglobin. Now here let us have a look on the RBCs, right? The structure of RBC. Now here we have a normal RBC. We can, as you can see in the picture, that the shape of the RBC is actually, it would be round. It is disc shaped, and also the normal RBC would be smooth and it would be flexible and it would carry oxygen. So here in the normal RBC, we have actually hemoglobin A, right? That is HbA. Now let us have a look on RBC, which has HbS, right? Which has an abnormal hemoglobin. So here, as I told you, that HbS does not carry oxygen, right? So it doesn't carry oxygen. Because of that, it changes its shape, right? So the shape would be a crescent shape, or we can say, sickle shape, or also we can call it as half moon shape. Also, unlike the normal RBCs, here, these RBCs would be sticky. It would be, stiff. It won't be smooth. It won't be flexible. So in sickle cell anemia patients, there would be healthy RBCs also, but along with that, there would be, these sickle shaped or crescent shaped RBCs which will not carry oxygen. So imagine in the blood there are these two types of RBCs. There are healthy RBCs also, and along with that there are these sickle shaped RBCs or crescent shaped RBCs. Right now, these RBCs does not carry oxygen, so it is not good for our body. So our body doesn't want it. Because the main motto here is that the hemoglobin would carry oxygen to the tissues and the organs, right? But here the hemoglobin that we have in a sickle cell anemia patient, these would not, meet that criteria, right? Because it won't carry oxygen, so it won't, the tissues and the organs won't get oxygen from it. So as a compensatory mechanism, our body would try to reject these, these unhealthy RBCs. So here there is an organ which would, play a major role, that is spleen. So spleen would, filter out all the RBCs which are healthy, which are not healthy. So here the spleen would, rapidly destroy these unhealthy sickle cells or the sickle shaped RBCs. So basically what is happening, there is only the healthy RBCs are remaining, and the spleen would, continuously rapidly destroy these sickle shaped RBCs, right? So definitely our body has to replace these sickle shaped RBCs with the healthy cells, right? So it would try to replace these healthy cells, but the problem here is that it won't be as faster as the spleen would work, right? So here what would happen, the rate of destruction is much higher than the rate of production. So in which rate the RBCs are getting produced is would be much lesser than the rate of destruction in which the spleen is destroying the unhealthy RBCs. So there is always a high demand for the healthy RBCs, right? And because of that, the body will be continuously in an anemic stage, and that's the reason it is called as sickle cell anemia. So in the name itself, it is mentioned that mentioned the word anemia, right? So the body will be always in an anemic stage because there is always a lack of healthy RBCs, and the body would try to match up with that, but the bone marrow won't be able to keep up with that. So till now we understood that sickle cell anemia is an autosomal recessive disorder where there would be abnormal hemoglobin, right? And what we mean by abnormal hemoglobin specifically, we learned that, right? And because of that, because of this abnormal hemoglobin, what actually happens to our body, that also we learned. Right. So now let us move on to the next part and see, how it can transmit from parents to the to the offsprings. So as I told you earlier that the child will inherit this disease from the parents, right? And we also know that this is a recessive disorder, so the gene has to be homozygous, right? The child has to receive this mutated gene from both the parent to get affected with sickle cell anemia, right? So here, if we have a parent who is who is a carrier, who we can call it as sickle cell trait. So in carrier, the gene will be HBAS. And then we have a parent who is completely healthy, who is having HBAA. So here there is 50% chance that the child will get one copy of HBAS. In that case, they would become a carrier because it is a recessive disorder, and for that they have to receive HBSS in order to get affected with sickle cell anemia. And also there are 50% chance that the child will get completely healthy gene, that is HBAA. So in that case, they would become completely healthy. Well, next let us see if both the parents are carrier. In that case, what would happen? So here there is 25% chance that the child will be born with sickle cell anemia, because the child can get one copy of HBS from one parent and again S from the other parent, because both the parent has this mutated gene, right? So in that case, there is 25% chance that the child will be born with sickle cell anemia. Also, there is 25% chance that the child will be completely unaffected, because the child might receive the healthy gene from both the parent instead of the mutated gene. So in that case, the child will become completely healthy. And there's 50% chance that the child will become a carrier, because the child might get one mutated gene from one parent. Now next let us see if one parent is carrier and the other parent is having sickle cell anemia. In that case, what might happen? So here there is 50% chance that the child will become a carrier, and there is also 50% chance that the child would be born with sickle cell anemia, because here there is in one parent there is HBAS, and in the other parent there is HBSS, right? So here there is no chance that any child will be unaffected. So either the child will become a carrier or else the child will be born with sickle cell anemia. Next, if one parent has sickle cell anemia and the other parent is completely unaffected, in that case, what might happen? So in that case, there would be, all the children would become carrier. So this is how this disease is passed down to the, to the children from the parent. Now let us move on to the signs and symptoms. Now in signs and symptoms, the first and foremost thing that we know the child will have would be anemia, because the body will be continuously in an anemic stage. So there are lack of red blood cells, and there is lack of oxygen also, because if there is lack of healthy red blood cells, then also there is lack of these healthy hemoglobins, right? Or the normal hemoglobins, which would carry oxygen to the tissues and the organs. So when there is lack of oxygen in the body, the child will become easily fatigued, and that's the reason the child will have fatigue. Also the child will have dizziness because of this lack of oxygen, and again because of lack of oxygen, child will also have pallor. Well, now here we have a picture where we can see that, the blood is flowing through a vessel, right? A blood vessel. Now, here we have both the type of RBCs, that is a healthy RBC and a sickle cells, right? A sickle shaped RBCs. So we have already learned the features or the characteristics of both the types of RBCs, right? So a healthy RBC would be, it would be smooth, it would be flexible, and is also round. But in case of sickle shaped RBCs, it is sticky. The shape also is, it is crescent, it is C shaped, and also it would be stiff, right? It is not smooth or flexible like the normal RBCs. Now, because of its shape and stickiness and the stiffness, it would certainly block the blood vessel, or block the blood flow. So here, as you can see in the picture, this would become clogged, or it would plug the blood vessel easily, and because of that there is blockage of blood flow. Now, due to this condition, the child will experience severe pain, and this condition is called as vaso-occlusive crisis or sickle cell crisis. So this pain is basically an episodic pain. So there would be episodes of this crisis, or whenever the child experiences this extremely, painful situation, this is called as crisis. So this is an episodic pain where, whenever this sickle shaped RBCs, it blocks the tiny blood vessels of the chest or abdomen, or it might, affect the joints or the bones also. So the child will have extremely, extreme pain or severe pain during that situation. And this is a major symptom of, sickle cell anemia. So this happens very often for some children, and for some children, it happens very frequently. So there are certain factors which aggravate this crisis. So let us learn what are the factors that might aggravate this, the crisis episode. So the first thing is if there is blood loss. So whenever there is significant blood loss due to any trauma or, surgery, in that case, what would happen when there is blood loss from the body is already in demand of, RBCs and also high oxygen, right? Because there are sickle shaped RBCs which does not carry oxygen, so the body is already in demand. And when there is blood loss from the body, what would happen? The demand would increase, and because of that, because of this low oxygen and this increased demand, there might be this crisis episode, or more of these RBCs might change their shape and become sickle shaped. And the next one is high altitude. So whenever we travel to high altitudes, what happens there is, the oxygen level is lower, right? So that would again, cause this crisis episode, because the sickle cell anemia, the sickle cell crisis episode basically happens due to, in any condition where there is low oxygen. Next, if there is dehydration. So in case of dehydration, what happens? The blood becomes thick, right? And the demand for oxygen also increases again. So again, this is a factor which can aggravate this, the sickle cell crisis. And apart from this, if there is stress, so stress would also increase the demand for oxygen. And if there is variations in temperature, then again that act as a factor, aggravating factor. So if there is hypothermia or hyperthermia, that might cause sickle cell crisis in a child. Now, hyperthermia, in case of hyperthermia, what happens when the body is having extremely higher temperature, the need or the demand for oxygen would increase. Right. So as I told you earlier that any condition which would cause low oxygen, or which has low oxygen, or which would increase the demand for oxygen, that would certainly cause this sickle cell crisis. So hyperthermia is such a condition, and again hypothermia. So if the temperature is extremely cold, or if you are providing cold bath to the child, in that case also the body would have increased demand for oxygen. So again, that is a factor which can agree with this sickle cell crisis. Next, there might be aplastic episodes. Why? Because again, there is short short lifespan of RBCs. Now, as we know, the normal lifespan of the RBC is 120 days, whereas here what we can see is that the lifespan of the hemoglobin S, or the sickle cell and RBCs, only 20 days, right? So even if the bone marrow is producing proper amount of RBCs, the bone marrow can't keep up with that pace, because that would only live up to 20 days, which is supposed to be there for 120 days. So you can understand, that the destruction rate is so higher, right? So that's the reason there would be aplastic episodes also. Also, there would be splenomegaly. Now, why splenomegaly? Because we already learned that the spleen would, filter the blood, because our body doesn't want these unhealthy RBCs, which would not, meet up the requirements, right? Because these unhealthy sickle shaped RBCs, these would not provide oxygen to the tissues and the organs, right? So our body would try to reject that. And how it would reject? The spleen would, filter out all the RBCs. So whatever the good or healthy RBCs are there, the spleen would certainly keep it, and the unhealthy RBCs would be destroyed by the spleen. So you can understand that, the spleen has to work faster, much faster, because the spleen has to destroy all these unhealthy RBCs, right? And that is the reason here the spleen is actually overworking. So because of that, there would be splenomegaly. Also, there might be infection, again because the spleen is overworking, and because of that there would be infection. Apart from these things, there would be dactylitis. Now, what is dactylitis? Dactylitis means there would be swelling of the extremities of the hands and feet. So we can see in a child who is having sickle cell anemia, or if the child is experiencing sickle cell crisis, in that case we can see that there will be swelling of the hands and feet. Next, there would be delayed growth, because these red blood cells provide the nutrients and the oxygen for the growth, right? So as if there is lack of RBCs, lack of red blood cells, lack of oxygen, that would also affect the growth, right? So because of that, the child will have delayed growth. And also what we can see is that there would be vision problems. Now, why vision problems? Because we have very tiny blood vessels which are going to the eyes, right? We just learned that the sickle cell shaped RBCs can block the blood vessels, right? So these sickle cell or the sickle shaped RBCs, if these blocks the tiny blood vessels which are going to the eyes, the child will have vision problems. So these were the signs and symptoms of sickle cell anemia. Now next, let us move on to the complications. So the complications of sickle cell anemia can be stroke, because again the reason is same, that we learned that the sickle shaped RBCs can block the blood flow, right? So if the brain is not getting proper amount of blood or oxygen, then there might be episode of stroke. Again, there might be organ damage. The reason is same, because of the blockage of blood flow. So the organ or the certain organs or tissues would be deprived of blood and oxygen. And over time, what would happen? If this happens for a long time, then over time this organ would become damaged. So there is a possibility, there's a complication. As a complication, it might occur that there might be organ damage. Next, there might be acute chest syndrome. Now, this is a life-threatening complication of sickle cell anemia. This might happen because the blood vessels in the lungs also might become clogged with this sickle-shaped RBCs. and eventually there might be there might be frequent infection, and because of that there might be acute chest syndrome. Next, there might be pulmonary hypertension. So, if these sickle-shaped RBCs block the blood vessels, then again there is a chance that the child will get pulmonary hypertension. Now, next, let us move on to the diagnosis. So, in diagnosis, the first thing that is done for to rule out this condition is sickle dex, which assess the hemoglobin S. But here, through this diagnostic measure, we can't confirm if the child has sickle cell anemia or sickle cell disease. So for that, to confirm that, we can do hemoglobin electrophoresis, where we can differentiate the normal hemoglobin and the abnormal hemoglobin, and also we can confirm whether the child has sickle cell anemia or sickle cell disease. Next, moving on to the management. So in management, our goal would be to reduce pain, because the during the sickle cell crisis, the child will have severe pain, and the sickle cell crisis episode is actually extremely painful. So our first goal would be to reduce the pain and also to prevent complications, and with that we also have to manage the anemia. So for that we would do blood transfusion. So the child will be given antibiotics because the child is more prone to infection. There is a risk for having infection. So till 5 years of age, the child will be getting antibiotics and pain relieving medication. So analgesics would be given, because as I mentioned that the sickle cell crisis episode is extremely painful. So to manage that, we have to give pain relieving medications, and also along with that we can give hydroxyurea. Now, this is given to reduce the frequency of the crisis episodes, and also along with that, this would actually lower the need for frequent blood transfusion. Also, the child will be given nitric oxide, because this would help in vasodilation, and also it would reduce the stickiness of the blood, because as we know that the sickle shaped RBCs would actually this is very sticky and stiff, right? So nitric oxide would reduce that. And the next treatment method is bone marrow transplant, which is also known as stem cell transplant. Now, this is basically done in people who are younger than 16 years old, and because it has, this is associated with a lot of risks and complications. So that is the reason it is done basically for the people who are younger than 16 years. And also for this we need a proper donor, because the HLA typing has to match, right? So because of that, this is a procedure which is actually very difficult to be done, because we have to find the donor. So for example, if there is a sibling with whom HLA typing can be matched, or blood from or stem cells from the umbilical blood can be also an option. Next, we would move on to the nursing management. So first we would discuss about the nursing diagnosis. So the first thing would be acute pain related to intravascular sickling, because of because this RBCs would get clogged, right, in the blood vessels, and because of that the child will have extremely or severe pain. So acute pain related to intravascular sickling. So here we would only discuss about the nursing diagnosis and the related factor. You can add the evidence factor based on the patient's condition. Next is impaired gas exchange related to decreased oxygen carrying capacity of the blood. And the third one would be ineffective tissue perfusion related to vaso-occlusive nature of sickling. Well, so these are the nursing diagnoses. Now, next let us move on to the nursing interventions. So, what are the nursing interventions that we should consider when we are, taking care of a child with sickle cell anemia, or if the child is having a crisis episode? Right. So first thing, we have to provide warm compress over the affected area. So when the child is having, a crisis episode, and if there is swelling on the hand and the feet, so or if the child is having pain, so in that case we can provide warm compress over the affected area and wherever the child is having pain. Next, if the child is having dactylitis, that is swelling on the hand and the feet, in that case what we have to do is that we can elevate the extremities. If the child is having dactylitis, then we would elevate the extremities. Also, we have to monitor the oxygen level, because already the child would be having lack of oxygen, and the child is anemic. So in that case, we have to make sure that the child is getting adequate oxygen. So we have to monitor their oxygen level. Also, we have to make sure that the child is getting adequate blood transfusion, because the child will be anemic, right? So in that case, we have to give blood transfusion in order to replace replace the deficiency, right? So we also have to make sure that the child is getting blood transfusion. Next, we have to monitor the respiratory function. So we have to monitor their their breath sounds, also the respiratory rate, and if they are having any signs and symptoms of acute chest syndrome. For all these things, we have to monitor their respiratory function. Next, we should also watch for signs and symptoms of gallstones. Now, why gallstones? Because there is rapid destruction of the RBCs, and when there is rapid destruction of RBCs, what would be produced? So when there is destruction of RBCs, there would be bilirubin which would be produced, right? So the gallbladder would try to make stone out of it. So there would be gallstones also. So we have to we have to make sure that we watch the signs and symptoms for gallstones. Also, we have to monitor the signs and symptoms for stroke. We have to monitor their neurological status, because the child might have seizure or any other symptoms of stroke. So we have to monitor their neurological status. Also, we have to check for their eye problems, because these sickle shaped RBCs might clog the tiny blood vessels which are going to the eyes, and this might cause eye problems in the child. So we have to monitor for, their vision also. So we have to check for if there is any eye problems. So these were some of the general nursing intervention. Now next let us see how to prevent the crisis episode. So as a nurse, so what we can do to prevent a crisis episode in a child. So the first thing would be increased hydration, because if we can increase hydration, we would be able to dilute the blood. So the stickiness would also decrease, because we know that because of the stickiness, this clogged the this plugged the blood vessels, right? And because of this, crisis episodes happens, right? So we want to prevent the crisis episode. So for that, if we can hydrate the child properly, we would be able to dilute the blood. So that would reduce the stickiness of the blood, right? So that is the reason the first thing we would focus on would be increasing hydration. Next would be rest, because again, if the child is stressed, in that case there would be higher demand for oxygen. So to avoid that increased demand for oxygen, we have to provide rest to the child. And we have to avoid high altitudes, right? So we have to educate the parents. We have to explain them that why higher altitude is not suitable for the child, and why it would cause problem, and how the child will be affected, right? So we have to explain about it to the parents, and also we have to instruct them to avoid taking the child to higher altitudes. And next is vaccines. So we have to make sure that the child is receiving all the vaccines, because we know that a child is prone to infection, right? Because there is splenomegaly, and because of that, the child might have frequent infection. The child will be vulnerable to infection, right? So for that, we have to make sure that the child is receiving all the vaccines, and we also have to educate the parents. We have to explain them what is the importance of getting these vaccines for the child. So these are some of the factors through which we can prevent the crisis episode. So that's all about today's class. Now let us conclude our today's topic here. So today we learned about sickle cell anemia, which is a genetic disorder in which there would be abnormal hemoglobin, which is HbS. So instead of HbA, there will be HbS, which is a crescent shape, and also it is sticky and stiff, right? So we learned about sickle cell anemia. We also learned about the management. I hope you have got a better insight about the topic. Thank you.